You have the power in your hands to improve both the oral health and the overall health of your residents. And individuals with better oral health care have a better quality of life. If you have good oral health, individuals tend to eat better, sleep better, require less dental care. And also, individuals with special health care needs may not be able to communicate that they are in pain due to a dental infection. And dental infections can cause weight loss, behavioral outbursts, or even longer processing times due to pain. Our job here today is to help you have the confidence and skills that you need to improve both the oral health and the overall health of your residents, and also maybe improve your own oral health in the process as well. Everything goes back to bacteria and plaque. We have millions of bacteria in our mouth that form plaque, which is a sticky, colorless film that covers the teeth. And certain types of bacteria tend to form tooth decay, and other types of bacteria tend to form gum disease. And when this plaque is able to sit on the teeth for a very long period of time with not a lot of brushing or flossing, you can start to see it, and that is seen in the blue arrow here above the tooth. If that bacteria is allowed to get under the gum, then it can tend to form gum disease, making the gums red and inflamed, and we'll get more into gum disease later on. Everyday plaque is invisible, however, and you can see on this picture on the left, titled number 1, the teeth look pretty clean. It doesn't look like there's a ton of bacteria or that they did a poor job brushing, but there are actually solutions or tablets that you can chew that make the invisible plaque visible. And you can see by the picture on the right, title number 2, there's actually a ton of bacteria left after this person brushed. Poor oral hygiene and diet can lead to tooth decay. So of course, sugar from a lollipop or sugar from a can of soda can break down to sugar and cause cavities. But there are other things in our diet that you may not realize that can contribute to decay. Maybe that big latte from Dunkin' Donuts or 100% apple juice. These all break down to sugar, and they interact with the bacteria in our mouth and create an acid. And that acid, interacting with a healthy tooth over time, can cause a cavity. But it's not just sugary foods that cause cavities, it's starchy foods as well, things that aren't typically sweet that you would think of. So chips, crackers, pretzels, bread, pasta, potatoes, rice. These are complex carbohydrates that break down to sugar, and the mouth recognizes that sugar just as it would be from sugar from a lollipop. So that breaks down to sugar, interacts with the bacteria, creates an acid, and that acid over time can cause cavities. It's important to watch for hidden sugars in both food and medication. Dietary supplements like Ensure or liquid medications, gummy vitamins, dried fruit such as raisins, they all have sugar that can contribute to cavities. Also, many of your residents may be taking pill forms of medication that have a side effect of dry mouth. This dry mouth reduces the amount of saliva in the mouth, and saliva has many protective qualities that prevent tooth decay. So just another thing to be aware of. I love this slide, and I encourage you to come back after the presentation is done and take a better look at it, because things that we have in our everyday life in terms of drinks have so much sugar in them. 100% apple juice, which seems, oh, it's healthy, it's 100% apple juice, has the equivalent of 10 Oreo cookies. You can see the equivalent of how much sugar is in Frosted Flakes cereal is in the energy drink of Red Bull. An iced latte from Dunkin' Donuts is the equivalent of 3.5 Krispy Kreme donuts. It's very important to note that things that you may not even realize do have a lot of sugar in them. So it all goes back to this acid attack. Within minutes of having a meal, whether it's a sugary drink or a starchy food, the acid attack begins, and the bacteria start making these acids. And if you're snacking or eating all day long, your teeth are never getting a break from the acid. And so we understand that you may not have so much control about what your residents are eating, but perhaps you can control when they're eating it. So if you are going to have something sugary or starchy, or your resident is going to have something sugary or starchy, in and around a mealtime is better than in between meal snacking. So even if they have a piece of cake for dessert, encouraging them to eat it in and around the time of dinner, not hours after. And so there are certain tooth-friendly foods. So of course, fresh fruits and vegetables are great for the teeth. Apples and cranberries have been shown to reduce cavity-causing bacteria. Cheese and nuts are healthy snack options. Drinking only water in between meals, and this limiting in between meal snacking is very important.